Hello everyone, I'm Dr. Jong from Lih-Ren Clinic. In the part 1 video, I introduced that the main cause of sick calf is hypertrophy of calf muscles. To reduce calf, we have to treat 3 larger muscles in the calf. Take this model of the left leg as an example. The 3 big muscles are medial gastrocnemius, lateral gastrocnemius. They are located at the superficial part of the posterior leg. The other one is soleus. Leg is deep to gastrocnemius. This is soleus. On the side, we can see the edge. This is the edge of soleus. In this video, I will introduce the way of treating this leg muscle. There are 3 ways. The first is Botox injection. The second is radio-frequent way. They can burn muscle. The third way is calf reduction surgery. Most of us are familiar with Botox toxin. Botox is used to trim, calves, front line, and so on. To slim face, Botox is injected into the masseter muscle. In the same way, Botox can be injected into gastrocnemius to reduce the thickness of gastrocnemius. It is non-surgical way of reducing leg, but the effect is temporary. It lasts only about half a year. Gastrocnemius is a thick muscle. To achieve significant result, the dose of Botox should be higher, so it is expensive. The second way is radio-frequent way. They can burn muscle. Radio-frequent muscle treatment is performed as follows. A probe is used to penetrate the skin and stuck into the muscle. Radio-frequent way, there is delivered through the probe into the muscle, can burn the muscle, cause damage to the muscle, produce fibrosis, and theoretically thin the muscle. The method did a very tiny wounds on the leg, but critically RF effects is temporary. Then I introduce calf reduction surgery. There are 3 methods of calf reduction surgery. The first one is cut the nerve that control gastrocnemius. The second is total excision of gastrocnemius. The third type is partial excision of gastrocnemius. I will introduce one by one. First, let me introduce cutting the nerve. As we know, if the nerve that controls the muscle is cut, the muscle cannot contract and the muscle will shrink inside, theoretically. The procedure is make a small wounds on the posterior side of knee, found the nerve and cut the nerve. Cut them off. The advantage of this operation are smaller wound, small operation, and fast recovery. The disadvantage is that this nerve that control the muscle varies from person to person. The nerves are different in number and pattern. If the nerves are not cut completely, the muscle will grow again. Sometimes the cut nerve may connect again, then the muscle will contract again and the muscle will return to previous size. Therefore, there may be difference between both legs after the surgery of cutting the nerve. For example, one leg is smaller but the other is bigger. All medial gastrocnemius after cutting the nerve get smaller, but the lateral gastrocnemius did not, so that the legs are asymmetric after operation. The meaning of total muscle excision surgery is that medial gastrocnemius and the lateral gastrocnemius are excised totally. The original concept of total excision is good because the effect of reducing in leg size is best than the other methods. But the leg is composed of many muscles. Can you imagine the shape of leg after lose 2 major muscle of leg? The surgery can cause depression on the medial side of upper leg. The legs look weird after surgery. The third method, also my recommended method, is partial excision of gastrocnemius. The operation procedure are the body side of the leg are marked before surgery. For example, the medial gastrocnemius is often prominent. All the bulging side of lateral gastrocnemius and the soleus are marked. Under spinal anesthesia, the excision is made on the posterior side of the knee. Using the instrument I designed, the superficial part and the bulging side of gastrocnemius I size piece by piece till the ideal shape of leg has been achieved. The deep muscle of gastrocnemius is preserved. I will take 3 cases, for example, to show you the concept of partial excision. In the first case, the lady saw her legs were very thick. I saw her legs were not thick. The medial gastrocnemius was a little bit prominent on the side I marked. The other part of her legs were fine, so that in the surgery I only excised the bulge part of medial gastrocnemius. The other part of her legs were left untouched. That picture was taken 13 years after surgery. The circumference of her legs was reduced from 3.35 to 32 centimeters. Although only 1.5 centimeters was reduced, the appearance of her legs improved a lot. In the second case, the lady disliked her thick legs. Before surgery, the circumference of her left leg was 39 centimeters and her right leg was 37 centimeters. There was 2 centimeters in difference between her legs. I sized bulging side of her medial gastrocnemius and the lateral gastrocnemius and the part of soleus as marked on the diagram. Of course, more muscle was taken out from her bigger leg. After operation, the circumference of her both legs was reduced to 35 centimeters. The appearance of her legs was significantly improved. In the third case, the lady underwent operation of cutting the nerves to reduce her legs at another clinic 4 years ago. As a result, her legs were obviously asymmetrical. Left leg was 35 centimeters in circumference. Right leg was 32.5 centimeters. She said that her left leg was the same as before surgery. Her right leg was smaller, but the surface of right leg was quite uneven. Right leg looks weird, she said. Before the surgery, I firstly marked the bulgy part of her leg. Just like the second case, I excised part of the medial gastrocnemius, lateral gastrocnemius, and the soleus muscle from the left calves. Only the bulge part of leg muscle was removed from right calves. After the operation, the leg circumference of both legs was reduced to 32 centimeters. The legs look thinner and symmetrically after the surgery. The concept of partial excision is to selectively excise unwanted part of the keep the needed parts, just like an artist to sculpt an art piece. Therefore, I call partial muscle excision surgery as a muscle sculpturing surgery. In conclusion, the calf muscle can be reduced with Botox toxin, high-frequent weight, and surgery. The methods of calf reduction surgery include cutting the nerve, total muscle excision, and the partial muscle excision. Among them, partial muscle excision is the method I recommend. I also call it sculpturing surgery of calf muscle. If you are concerning your sick legs, you should find an experienced surgeon and consult with him to find out the most suitable method for you. Thank you for watching.